Does your loved one suffer from diarrhea and they have a wound? I'm here to help you. I am Bienstock and I'm a board certified plastic and reconstructive surgeon. My specialty is wound care for those that are homebound and bedbound, particularly in the elderly population. It's not uncommon that my patients have tube feeds, meaning they have a tube in their stomach where they're getting tube feeds, and they have diarrhea or loose bowel movements. This can be a problem in terms of managing the wound. If you're having profuse bowel movements with fecal contamination going into the wound, it can make it very challenging to heal and even lead to wound infections. We want to prevent this. But more importantly, we want to understand, why does your loved one have diarrhea if they're getting tube feeds? Most of the time it's due to the fact that they're getting continuous feeds. That means they're getting constant liquid going into the stomach. This is like running a marathon every day. I mean, your stomach, which also has muscles in it to process the food, is getting overworked, meaning it's running non-stop 24/7. I'm not a huge fan of continuous feeds because our body's not meant to absorb foods that way. Can you imagine having 15 meals a day? That's very difficult on your system. It's better to have what we call bolus feeds, meaning having 3 or 4 meals of larger volume. It's easier to process and most likely have better absorption. Sometimes it's actually whatever you're actually getting in the feeds. A lot of people get tube feeds that's very processed. Sometimes it's Ensure, 1 cal, 1.5 cal, things like this, and the body is not processing it. A lot of times it's due to the fact that these are not really organic feeds. Some of my patients, I recommend switching to K forms, which is a lot cleaner. This seems to resolve things. You can even think about pureeing organic foods and putting it through the feeding tube. Now, if you don't have a feeding tube, what do? A lot of times it may be your system, it's not used to certain foods, or you have what's called food sensitivities. You may be getting too much of 1 or 2 foods. You have to figure out what foods are not agreeable with your system. Another thing that can cause profuse diarrhea, which can be very problematic for wound healing, is having certain things that loosen your stool up, such as colace. If you're having irregular bowel movements between having constipation as well as inconsistency, I would remove some of the stool softeners if you're having continuous bowel movements. And you make great changes as you need to in your own diet with the feeds, whether it be food. You want to avoid foods that are very binding, so you want to have more of a high fiber diet if you're tend to have constipation. And if you're having a lot of diarrhea, you need to make sure you're not having too much fiber or not too much liquid. If you have any questions below, I'm here to entertain them. I look forward to our next session. Thank you very much, and make sure you subscribe to the channel.